Extrinsic regulation of the glomerular filtration rate occurs by two mechanisms, neural and hormonal. Let's begin with the neural mechanisms. Recall that the sympathetic nervous system innervates your blood vessels. An increase in sympathetic input will bring about vasoconstriction, and a decrease will result in vasodilation. During hypovolemic shock, a condition where an individual loses large volumes of blood, the blood pressure will drop. In order to maintain the blood pressure gradient, returning the blood back to the heart, systemic vasoconstriction occurs to non-essential organs. The kidneys are considered a non-essential organ. The heart must pump the blood that has returned to it to the lungs for gas exchange, as well as to the brain to provide the much-needed oxygen. As a result of this, the kidneys will become hypoxic, and this will result in renal failure unless addressed. The hormonal mechanism involves the renin-angiotensin-aldosterone mechanism. Recall that renin is released when blood pressure drops below normal. It is released by the JG or granular cells of the juxtaglomerular complex. There are three mechanisms that will stimulate the release of renin from the JG cells. The first is the neurotransmitter norepinephrine released by the sympathetic fibers. The second is a chemical messenger released by the macula densa. This chemical messenger then will travel to the JG cells and stimulate them to release renin. The macula densa release these chemical messengers when the sodium chloride concentration in the filtrate drops below normal. Remember that what drives filtration is the blood pressure within the glomerulus. When this blood pressure drops, the glomerular filtration rate will drop. This will slow the movement of the fluid or the filtrate through the renal tubule, allowing for more sodium chloride to be reabsorbed. As a result, the levels of sodium chloride will be decreased below normal when the glomerular filtration rate is below normal. The last mechanism that stimulates the JG cells to release renin is the myogenic response. When the blood pressure drops, the smooth muscles in the arterioles feeding the glomerulus are not stretched. In response to this, the JG cells release renin.